Hi all, welcoming to you all to our very own series Awareness of Women's Health. In this video, we will be talking about osteoporosis. Preventing bone loss has been one of the major concerns in women during the menopausal as well as the postmenopausal stages. Menopause significantly speeds bone loss and it increases the risk of osteoporosis. So let's look upon osteoporosis in much detail.
Osteoporosis is a medical condition characterized by low bone density and structural deterioration of bone tissue leading to an increased risk of fractures. It is often referred to as a silent disease because you typically do not experience symptoms and is often only diagnosed after a fracture occurs. Our bones are made up of living tissues that undergoes a constant process of remodeling, with old bone being broken down by cells called osteoclasts and new bone being formed by cells called osteoblasts. In individuals with osteoporosis, the rate of bone breakdown exceeds the rate of bone formation, resulting in decreased bone mass and strength. Osteoporosis is characterized by reduced bone mass, and the disruption of bone architecture results in increased risk of fragility fractures. Osteoporosis-related fractures are associated with substantial pain, suffering, disability, and possibly even death for the affected patients. The causes of osteoporosis can simply classify into primary and secondary osteoporosis. Primary osteoporosis is generally age-related and influenced by hormonal and dietary elements, while on the other hand, secondary osteoporosis occurs as a result of various medical conditions and medications. Primary osteoporosis. Primary causes of osteoporosis can be further divided into type 1 and type 2. Primary type 1 osteoporosis occurs as a result of hormonal changes occurring in postmenopausal women. It is influenced by the change of balance in estrogen and progesterone levels, which are responsible for the union of osteoblastic and osteoclastic activity. Estrogen regulates the osteoclastic activity and progesterone is involved in osteoblastic activity. Primary type 1 osteoporosis is common after 10 to 15 years of menopause, and it usually occurs in the age group of 50 to 70. It occurs due to decreased estrogen levels in the postmenopausal women, resulting in increased bone loss. Primary type 2 osteoporosis. It is also known as senile osteoporosis, which generally occurs as a result of chronic low dietary calcium. Some factors such as hyperparathyroidism can influence calcium metabolism. This is also referred to as low turnover osteoporosis because the rate of the bone turnover is much lower than osteoporosis and is more common with a high rate of hip fractures. Secondary osteoporosis. Certain medical conditions have been found to increase bone remodeling, which results in the interference or disruption of bone reformation. Some common conditions which are involved in promoting osteoporosis include hyperparathyroidism, diabetes, thalassemia, multiple myeloma, intestinal malabsorption, leukemia, liver disease, and Marfan syndrome. Certain medications have also been found responsible for causing osteoporosis, such as antacids, heparin, and anticonvulsants. Risk factors. Risk factors play a significant role in the development and progression of osteoporosis. Certain risk factors are non-modifiable, such as sex, advancing age, ethnicity, and genetic factors. Nutritional factors. Calcium and vitamin D are the two main nutrients involved in the bone health, which play a major role in influencing the risk of osteoporosis. Calcium in the form of hydroxyapatite crystals is deposited in the bone matrix, which is responsible for the hardness of bone. Calcium is obtained from the diet through dairy as well as non-dairy sources. Several studies have reported that Indian diets do not meet the recommended dietary requirements of 600 mg per day of calcium for women, which has been recommended by the Indian Council of Medical Research. Other studies have revealed that Indian diets have a higher ratio of phytates to calcium, especially among rural Indians. Phytates hinder calcium absorption from already calcium deficient diets and thus retards the bone remodeling process. This can result in lower bone mass density, which increases the risk of osteoporosis. Vitamin D. Vitamin D is synthesized in the human skin upon exposure to sunlight. Some of the causes of vitamin D deficiency include low sun exposure, inadequate dietary uptake, poor vitamin D fortification of food, and highly pigmented skin. Vitamin D deficiency results in ineffective calcium absorption from the gut, which affects the mineralization of the bones. Various studies have implicated that functionally significant deficiency of vitamin D affects bone mass density at the hip and has linked to the increased risk of osteoporosis. Lifestyle factors. Various lifestyle factors such as excessive alcohol consumption, smoking, caffeine intake, and physical inactivity has been linked with an increased risk of osteoporosis. These factors interfere with the body's ability to absorb calcium and thus affects calcium absorption, resulting in the increased risk of osteoporosis. Menopause. Menopause is one of the common causes of osteoporosis. As hormones change to adapt to normal menopausal changes, estrogen levels starts to fluctuate and drop. During the menopausal stage, women naturally have lower level of estradiol as the ovaries do not produce it and thus causing the menstrual cycle to stop. Over time, lower estradiol level lead to osteoporosis. Diagnosis. The gold standard for the diagnosis of osteoporosis is DEXA test, dual energy X-ray absorptiometry. It is a radiological diagnostic test and is universally classified by T and Z score. T score is the measurement of bone density compared to younger people and estimates the risk of fractures, whereas the Z score measures the bone density of the comparable age group. Most guidelines use T-score as a standard approach for estimating fracture risk assessment and treatment. T-score above -1 are normal. A score between -1 to -2.5 is classified as osteopenia, and anything less than -2.5 is osteoporosis. The secret to good bone health is pretty simple. Provide your body with the nourishment of vitamin D and calcium, get exposed to sunlight, and indulge in weight-bearing exercise to give your bones a golden chance to live a healthy and a strong life.